What is a corticosteroid injection and when should you get one? Well, let's talk about it. Let's speak joint injection specifically. Corticosteroid is a potent anti-inflammatory that can help decrease inflammation on the inside of the joint space. Now, we do have our contraindications to those joint injections, so not to get too technical, but some people cannot have those. But for those that can, we do try to help out a little bit. So for example, if someone's in physical therapy and they're getting better maybe functionally, but the pain is still significant, we can try a corticosteroid injection in those instances to help that patient move forward in their therapeutic exercise. Similarly, if someone hasn't started a physical therapy or home exercise program, we can use that injection if they're really significantly in pain and they feel like they just can't move. And so we do that to hopefully get them going in that direction. Lastly, if a patient has an acute injury, let's say they're at their job and maybe they're lifting and they have sudden, inflammation of the rotator cuff, for instance, we can utilize a corticosteroid injection in that case to help them quickly get back to their job. So overall, steroid can be a helpmate for some, but nothing is fail-safe, so not every injection works for everyone. Sometimes injections also, they last for maybe a couple months, and some people might get total relief and they just move on with life. But not everyone's the same, and for the most part, the patients that I see, they typically come back for at least a couple of corticosteroid injections to help them feel better. Because most of those folks that I see, they have osteoarthritis, and those conditions are chronic and can cause more of a chronic irritation. So maybe they need these here and there to just continue to keep going. And lastly, I will say that we don't want to do these types of injections forever in anyone's joint, because over time, too much of a good thing can turn into a bad thing, like I've said plenty of times on this channel, and that steroid can degrade the joint space after a while. So if you're doing a bunch of them over time, you could be damaging the joint lining. Have you ever had a corticosteroid injection? Well, comment yes in the comments, and then also let us know what joint.